we're moving towards an era when maybe you'll get your, or whoever will get their tumors sequenced, that the days of women who are diagnosed with breast cancer being told whether you're ER positive, estrogen receptor positive, progesterone receptor positive, or HER2 new, overexpressing, that really is just a very small subset of the information that you're going to have to discuss with your doctor. And so, you know, things are rapidly changing. Targeted therapies are out there, and now the issue is how do we really match the right therapy for the right individual? So a breast cancer in the breast is not the same as the breast cancer that gets out of the breast and spreads to the bone. Now, when doctors treat, generally they treat based on the biopsy. And so they say, well, you know, we're doing an analysis of your tumor, the primary tumor. Sometimes that could be 5 years old. You know, it's in the archives. And somebody may be diagnosed with early stage and then unfortunately progress. And everything is based on that original biopsy. What we know now is that, as depicted here by the different colors, that from a molecular standpoint, from the wiring of the tumor cell, these are very different entities. And if you treat this or this bone metastases or the liver metastases based on the information that you have from 5 years ago, it's no wonder that we're even making any headway. And that what we really need to move towards is treatment based on the totality of what's in the body, okay? Not just based on some biopsy that was obtained several years ago and that predates chemotherapy, and I just showed you that chemotherapy affects tumor cells in the microenvironment, but something that is real time and preferably something that really characterizes different sites in the body. And I could tell you that well, we just had a meeting because it's really not practical to go biopsying, in some cases, multiple sites of disease. And what we're really moving towards are non-invasive imaging modalities, where we could actually, you know, and it sounds sort of Star Trek or futuristic, where we could take a scanner and actually come up with the molecular profile of tumors throughout the body. And so I think that in the next few years is what you're going to be seeing more of, is the ability to look at the individual in totality and to be able to give a better indication of how we treat. Is that we can't detect what we call micrometastatic disease, okay? So if you get an MRI scan or a CT scan, that level of detection will only pick up a certain amount of tumor cells. So once you've maybe reached 10 million tumor cells. But it doesn't tell you that there may be a tumor down here of only a collection of only a few hundred tumor cells. And so there's another need that we need to develop, which is how do we detect women with micrometastatic disease, where someone may go to the doctor and be told, the good news is you've got early stage breast cancer, stage 1 disease, based on all the information that we have, when in fact a year later something pops up here or something pops up here. And people say, well, you know, I was just told that if I had a lumpectomy and radiation, everything would be fine. When in fact, those tumor cells, which were undetectable by conventional scanning, were present. So you may have heard a lot of excitement around blood tests that can detect circulating tumor cells, that can detect 1 in a million or 1 in 10 million tumor cells. And some of those are available now and are commercially available. And the ones that are highly sensitive, that can detect 1, you know, in 100 million and can almost give you this sort of detail, profiling at the molecular level, are still in clinical development. Breast cancer is not a homogeneous disease. There's a lot of molecular subtypes. We have to start personalizing our approach, our understanding. The days when this is all you're going to get from your doctor are long gone, or they should be gone soon. Personalized approach to treating, or ideally even preventing, and individual plans based on profiling all tumor sites of disease.